Look, every country in the world is fighting for a prime place in the vaccine lineup. Critics say Canada's stuck at the back of the line. The truth is, we're not. Most countries are actually at the back. They may not see a vaccine for years. We're vaccinating people now. I know in frustratingly low numbers right now. But with new variants of the virus spreading, shouldn't getting as many people around the world vaccinated as possible be in everyone's interest? But the patents to the vaccines belong to the pharmacy companies. Should they be made public to allow generic production of the vaccines? After all, public money did go into developing a lot of these vaccines. Are we ignoring lessons the world learned from the first AIDS epidemic? Stephen Lewis knows a lot about this. He's the former UN Special Envoy for HIV/AIDS in Africa and currently co-directs the advocacy organization AIDS Free World. Mr. Lewis, good to have you back. And it was good to have you on the radio today. Obviously, it's a moral moment, a health moment. Everyone's rushing to get a vaccine. Canadians are deeply frustrated. Tell us the role patents are playing and how you think there is a better, more equitable path.
There should never have been patents accorded for these vaccines, Evan. We have elevated to a kind of sublime heroism the pharmaceutical companies like Moderna and Pfizer, but in fact, the great mass of funding that has gone into the discovery and manufacture and delivery of these vaccines has come from public funds. And we shouldn't be giving patents to individual drug companies for the circulation of the vaccines. And indeed, a number of countries in the world, low-income and medium-income countries like South Africa, India, and almost 100 others, have gone to the World Trade Organization and begged that organization to suspend the patent protection for the pharmaceutical industry for the life of the pandemic so that the drugs can be produced the vaccines can be produced generically at much lower cost. Many years ago, when the cost of AIDS drugs was so high, precluding treatment for millions of people on the continent of Africa. Do you know, back in the late 1990s, early 2000s, Evan, the cost of treatment was $12,000 or $13,000 per person per year. And when the government of India decided to allow the generic companies to produce the drugs inexpensively, it dropped, believe it or not, to $350 per person per year. It's now down to $100 per person per year. There is no reason for companies like Pfizer to be making these obscene profits when the discovery was publicly funded.
Now, the WTO, the World Trade Organization, has an agreement called TRIPS, the trade-related aspects of intellectual property rights. I know that sounds complicated, folks, but that's what the vote was about. That is a mechanism that balances basically patents and public health. Now, that vote didn't happen. Obviously, you need 2/3 of a majority, and it didn't work. So now what? A lot of big pharma might say, well, Mr. Lewis, we took the risk. We get the reward. It's very expensive to develop vaccines. And Moderna and AstraZeneca have agreed not even to sell these vaccines at a profit, just at cost. We haven't seen the contract, so it's hard to verify. But what do you say to that when people say pharma takes the risk, that's why we're dependent on them?
Well, Pharma, it is estimated, will make at least $20 billion of profit in the year 2021. They made, in the case of Pfizer, almost $1 billion of profit last year. It's said that Pfizer is making 60 to 80% profit, and AstraZeneca is likely to make 20% profit. This business of providing the drugs at cost should be taken with a barrel of salt, Evan, because the drug companies themselves decide when they will stop providing the drugs at cost. There's no guarantee it's going to go on through the life of the pandemic. The drug companies shouldn't be extracting these kinds of profits. We are dealing with a kind of renaissance of colonialism here. We have the wealthy countries pre-purchasing millions upon millions of doses. Evan, the wealthy countries, they're about 16% of the world's population, and they have already purchased 60% of the available vaccine doses. And you can't have that kind of inequity and expect to overcome the damage, both in health and economic terms, of the virus. And by the way, at the World Trade Organization, while the low-income and middle-income countries pleaded that the patents be lifted just for the course of the pandemic. They said, then restore them. By all means, restore the profits for the drug companies. But in the case of the coronavirus, lift it for the time being. They were opposed by the European
Yes.
Union, the United Kingdom, the United States, Australia, Japan, Canada, and by the way, Bill Gates. When it comes to corporate interests, Bill Gates knows where his interests lie.
I want people to understand something, though. The request is not so the Big Pharma loses money. They're happy if Big Pharma actually gets their money back, just not makes a profit. They just want these patents for the life of the pandemic to be public for generics. Because, you know, when you and I spoke earlier, some people wrote to us and said, but wait, we don't have enough vaccines here in Canada. Now Mr. Lewis is saying, let's help everyone else. We've got to get our supplies in first. But that's not what you're saying. Can you answer that question?
No, I'm really mirroring the words of the head of the World Health Organization, who said that we're on the brink of a cataclysmic moral catastrophe where so much of the world is alienated from the availability of the vaccines. I'm not suggesting that Canadians shouldn't receive the vaccines as soon as they're available. I am suggesting that the government of Canada should. I would love it if this were possible. It isn't a romantic impulse, Evan. I just believe in it. If the government of Canada were to come forward and offer a very significant amount of money to the central vaccine agency called COVAX, run by the World Health Organization, which is designed to serve the developing world, to serve low-income and middle-income countries. And if we gave a couple of $1 billion instead of a few $100 million, I point out to you that it's less than 0.5% of the deficit we have accrued. It's said at the World Economic Forum this last week in Davos that the virus is costing us $9 trillion. It would be a tiny microscopic portion of that to provide the money necessary to give vaccines to everyone in the world and maintain the privilege of Canada and the other wealthy countries.
And just one last, I got about less than a minute, Mr. Lewis, but if the patents were made public and the drug companies didn't lose and generics were allowed, that would increase the capacity for production here in Canada. That might also help solve the domestic production issue, wouldn't it?
Absolutely. And I think that is something we should focus on. And the data from these companies should also be available in a sense of absolute transparency, Evan, because then you can have the generics emerge. I think it would be very, very valuable for Canada and might allow the production facilities to operate at a higher level.
Stephen Lewis, the lessons from the AIDS epidemic and the drugs available then and the vaccines available now, and the issue is patents and intellectual property, fascinating. And I don't think we've had this conversation nearly enough. I appreciate you bringing it up with us so much. Thank you, Mr. Lewis.